in my view, is to provide them with the tools and the opportunities that they need to be able to live their best lives. That includes education opportunities, and that includes provide increased funding and visibility for agencies like Planned Parenthood that provides so much, so much of the critical services that we need for our community. It's not just birth control services, it's critical education services. And they provide unique sort of Title X type services that no other agencies are able to provide. Again, if we're looking at the problem of HIV specifically, that involves community outreach. It involves giving people access to what we saw up in Scott County with the horrendous HIV epidemic up there. Those folks need clean needles, and they need resources, and they need ways in which that they can combat addiction overall, not just how are we going to stave off HIV. That's sort of like striking at the branches of the problem. To strike at the root of the problem, we need to get down to what is causing addiction in our communities. Why are people not being adequately educated, both in terms of drug addiction and sex education, and how do we weed out those things? And again, it's another one of those instances in which we tend to be penny wise and pound foolish. If we invest a little bit in our communities in terms of education and resources, we see those investments pay dividends over time, in which we don't have to take care of people in our jails and our hospitals and pay a whole lot more on the back end. So I think it's a simple matter of investing up front. Thank you.
Well, I know from experience that activism, actually getting money to organizations, not even necessarily big ones, but small ones, that can go into, like in the gay community, often we have organizations that go in and they're at the bar and they hand out contraception, and they do testing. Actually, I was at an event a couple weekends ago. I got tested. I'm negative. But personal responsibility is a big thing that we need to teach people. But educating, especially the younger folks, any kind of epidemic that we have, education, knowledge, but we also have to have the funding behind that. Sometimes we need money. We need money to buy things like hospitals and healthcare services, and organizations need these funding, whether it's as a government front or kind of a private sector kind of thing. But the best results that I have found is interaction and just really getting the availability of these things, testing, and going to the groups that probably need more help than what the other folks in the community are. So like we're targeted in the gay community to get these services often, and it's good. It works. So going to them, communication, education, having the money for the programs that we need.
So certainly we can talk about prevention, and then we can talk about intervention and healthcare. I think it's very, very clear that we need to make a much more significant investment in our healthcare system than we're making. We still have millions of Americans who aren't covered. We need to make sure that every single person has healthcare coverage. I'll tell you what not to do. What not to do in Scott County. Scott County had an HIV outbreak and then had to spend millions on the investment in trying to help folks in their community get back on their feet. That's why the needle exchange programs that we have too few of here in southern Indiana are so very important. And I was in Lawrence County at that hearing where they voted to take away the needle exchange program, and I'll tell you that nearly every single doctor who spoke, for sure, almost every single witness, said just how important those programs are to preventing another Scott County, and they voted to take it away anyway. So we have got to start actually doing what the evidence says. We have to start, there's a thing called evidence-based public policy. It's actually a really good idea. And so we should start listening to the evidence. We should start making sure that we're making contraception widely available. As you may know, Trump has now decided that religious institutions don't have to provide it. My former employer, National Women's Law Center, just sued Trump on behalf of Notre Dame students in order to fight for their access to contraception, and that's so important. So these are some of the things that we need to do, and of course it's very clear that we also need to get back to making sure that we have good paying jobs available in our community, because the link between lack of economic opportunity and people turning to drugs out of desperation is very, very clear.